Hello everyone. My name is Al-sodaire BS1B student of Notre Dame of Takuro. So today I will present to you our return demonstration about taking vital signs or cardinal signs. So the definition is the measurement of physiologic functioning, especially body temperature, blood pressure, um, pulse, and respiration. So the purpose is to serve as guide in meeting the needs of the client. Second is to aid in planning of care of the client and to establish baseline values of the client's cardiorespiratory integrity. So temperature taking. So the definition is to balance between heat production and heat loss by the body. So the purpose is to determine alteration in thermo-regulating system of the body and to establish baseline data for subsequent evaluation. So auxiliary method, so our equipment to use is alcohol and cotton balls, auxiliary method or auxiliary thermometer, and paper and pen. So our first procedure is to identify and explain procedure to the patient and to ensure correct procedure to the right patient. So to explaining procedure reduces anxiety and fear, thus promoting cooperation from the client. So hi ma'am, good day. I am Al-sodaire I am your nurse for today. So how are you ma'am? You're okay? So second is assess the client's condition or assess the client's skin if warm to touch. So to assess the signs of fever. Third is assess for most appropriate site to check the temperature. So the rationale is to save time and to identify the correct thermometer to be used. Here's a thermometer. So fourth is gather equipments needed. So the rationale is to facilitate systematic assessment and measurement. So ito po yung mga gamit natin. And next is wash hands. So rationale is reduces transmissions of microorganisms. So next is draw curtain around bed and close the door. So, to maintain client privacy. So wala tayong curtain. So next is assist client in supine or sitting position to provide easy access to axilla. So the next is move clothing or gown away from shoulder and arm. So the rationale is to expose axilla for correct thermometer placement. So ma'am, itataas lang po natin ito ma'am. Next is put the axilla if very moist. The tip is placed in the center of axilla. So rationale is to prevent incorrect reading of temperature. So next is insert the thermometer and leave in place for the required amount of time. Place arm across the chest, usually 2 to 3 minutes. So some thermometer gives short beeps when reading is done. So the rationale is to provide enough time for recording of the temperature. So next is inform client of thermometer reading to provide participation in care and understanding of the status. So normal naman po yung kuwan natin, ma'am. So temperature nyo. Next is dispose and what dispose, wipe and use contaminated items in a receptacle. So the rationale is confining contaminated articles helps to reduce the spread of microorganisms. So next is evaluate the temperature taken rather to identify if the client has normal or abnormal body temperature. So normal naman po ma'am no yung temperature natin. So don't worry. So last is record the result in graphing sheet for documentation. So rationally to serve as baseline data health or to serve as baseline data for health care providers. So that's all. Thank you.